Greetings, Dr. Washington and classmates. What are the sources of power often seen in an organization? Healthcare organizations are composed of various sources of power. The most common ones are legitimate power and referent power. Both examples are ones used by leaders in order to gain support from its members of their team. Healthcare organizations in particular are in need of their internal stakeholders to rally behind the strategic goals that have been placed. Referent power derives from the driving agent's personal charisma and is an effect on the recipient of influence. The recipient attribution of prestige to the driving agent leads to a desire to please or eliminate the agent. Freites 2014, section 6.2. Additionally, legitimate power is a commonly used power tactic by healthcare organizers. Legitimate power derives from authority and social and cultural norms. It involves loyalty, social rank, and the organization's hierarchy, so that the influenced individual believes the driving force agent's use of power is just and right. End quote. Freites 2014, section 6.2. What are the negative impacts of an organization when its members exercise power and play political games within Mittsburg's political game playing framework? Mittsburg's political game framework discusses how decreasing the patient-to-nurse ratio can negatively impact the overall safety for patient care. The hospital's compliance officer falsified records to indicate the nurse-to-patient ratio was a higher number in order to pass the JCO state standard oversight. Freites 2014. The negative impact of this decision is that there will be fewer nurses available to perform licensed nursing procedures. In particular, nurses are required to administer intravenous therapy medications within the standard prescribed time frame. Trained nurses must also respond to emergency situations without compromising the safety of other critical patients. Furthermore, patient safety would be compromised if nurses were required to provide direct care for high acuity patients or critically ill patients, in addition to performing routine assessments on their patients that are transferred to the medical floor. I can recall a personal experience of a negative impact of this. As a newly graduated nurse, I worked on the medical surgical unit. During that time, it was customary for nurses to have 3 to 4 patients on their shift. The ratio of patient to nurse ratio was within a standard and safe practices. I can recall in particular one time a house supervisor wanted the charge nurse to be assigned 2 additional patients due to overall patient census. The charge nurse spoke up about the level of patients and the risk for patient safety. After that, the house supervisor reassessed the situation and reassigned the patients to other nurses within the hospital floor. Quote, scholars also agree that willingness of employees to speak up when they witness a practice or behavior they believe to be morally wrong is essential in preventing unethical activity from spreading insidiously within organizations. End quote. Wellman 2016, page 793. This diversion saved the hospital from a potential adverse event.